I also want to give you a personal pandemic account as a new MP elected in 2019 and someone that represents a Welsh border constituency just about 4 miles from the city of Chester. And if we recall back to 18 months, we didn't know what we were facing, and there was a call to arms with anyone that had any skills and any time to come forward and support their communities. And I answered that call because my previous life, I was a nurse and social worker. My nursing registration had just lapsed, so I reskilled and upskilled, and I went back to my local hospital where I had trained 30 years prior. I'd upskilled on resuscitation, you'd be pleased to know, IVs, blood glucose monitoring, and I donned the uniform and I went back. And it was an absolute privilege to work shoulder to shoulder with my NHS colleagues, caring for my constituents who only 4 months ago had elected me as the first Conservative MP for Wrexham. And just something I want to also mention here is that many of those clinical staff I was working with, doctors, nurses and support staff, were from around the globe. And they did an excellent job supporting our NHS, in this case the Welsh NHS, during those times. I want to really touch on the vaccine as well. It is a brilliant example of how the combined strength of the union won the day. And I want to talk about the Oxford AstraZeneca vaccine, produced in England, bottled in my constituency in Wrexham, in North Wales, trialled in Northern Ireland and rolled out in Scotland, and Annabelle will be pleased to know, supported throughout by the military. And I want to take this opportunity to compliment the team at Wockhardt Pharmaceuticals, led by Ravi Limier, for their can-do, will-do attitude, which enabled us to have the successful vaccine rollout programme that we did. Wrexham is a stronger place as a result. We have a positive COVID legacy. We are outward looking. We cross borders. In Wrexham in particular, because of the Wockhardt influence, our university, our businesses, our colleges are really keen to invest in STEM, healthcare and life sciences, and they will be accepting students who live in England as well. And lastly, Wrexham is a town with renewed hope and optimism, and that's actually really tangible. And as their representative, as their MP, I will capitalise on that for the greater good of Wrexham.
Very much, Sarah.
If you are a patient in North Wales and you need specialist facial maxillary work, you will go to Liverpool. If you have broken bones, hips, knees, you will go to Gobowen. We don't have the specialist hospital support in North Wales as they do in South Wales. There's a great big clump of area in between called Powys. So we tend to, from North Wales, look to Wirral, Liverpool, Manchester and the North West. Cross-border, we live with, we work, we play, we shop. We are not confined by boundaries. It's only politicians and legislation that confines us by boundaries. So we really look over the border. We have reciprocal arrangements with the English NHS so people can get the healthcare they need across that border. It has been an issue during COVID, but it's a manufactured issue. It's not how we live our lives. And for me as a new MP, sat right on that border, it's been quite challenging to get the support that my residents have needed.
Sarah, again, you talked in your remarks about the work you did at that time, both locally but as a constituency MP. Do you want to say a little bit more about what that was like for you, newly elected a few months beforehand, and then straight into both serving your community on a very practical level, but also dealing with that flood of casework and making sure that, just as Sandra said, it was your constituents, the individuals, who came first rather than any party political agenda. What were your reflections?
Yes, when I was on the wards, exactly the same, doing 12-hour shifts, fully garbed up. It was all about protecting your patients. You don't think about anything else. You're just there to do that job. And it's a human instinct. You're not thinking, are they Welsh, are they English, where they're from, where do they live? that is absolutely irrelevant, and you're just doing that and you're just getting them through that day and supporting your colleagues, because it was a highly pressured, stressful environment. Health is devolved, it's run by Welsh Government in Cardiff. We've got serious problems. In fact, only this morning I was in touch with my local health board due to issues. So healthcare and regulations were really quite highly relevant to my constituents at the time. And the casework came flooding in. I really was not expecting so much casework as a new MP, and my team were excellent. Actually, they're sat over there, so I better say they were excellent. They were excellent, and they really, helped Wrexham out at a very difficult time. Quite simply, I'm a Welsh woman. I'm very proud of my heritage, my background, and I will wear a Welsh rugby shirt when I go and watch Wales versus England. But when England are playing France, I will wear an English shirt because I'm a unionist and we are stronger and better together.